Top reason for patients having mistrust in their doctors is they say they spend too little time with me. They do not know me. They do not listen to me. And then they do not give me all the information. They are too financially motivated. And then there's even some folks who say they do not make eye contact with me. And then there's other reasons. As for on the right side, we have a chart talking about physicians and why they think their patients have mistrust in them. They think it's poor communication, high costs, challenges with insurance coverage, being treated differently by demographics, perceived economic self-interest, misdiagnosis or medical errors.
And this is the importance of trust in the health relationship, and that trust is a two-way street, at least. Humans are naturally relational beings. We're relational creatures, especially in matters of health and survival, which healthcare is very connected to our well-being and our sense of aliveness, of being safe in the world. And so this relationship goes two ways, not only patients needing to trust their providers, but providers needing to trust their patients. And then we have an added area of trusting a third party, a third thing that is very much a part of the healthcare system and the government policies and healthcare and insurance companies that impact this system.
Yes, there's a lot of facets to this that we need to explore. Here's a chart saying, how trustworthy do you consider each of the following to be as spokespersons for medical and health research? So you can see there's different categories here for scientists, public health officials, family and friends, the federal government, some of the things that Leslie just mentioned, in fact, online medical forums, TV, radio, podcast, right? What do people consider as trustworthy information?
Just because I agree with Leslie, and there's a reason this slide of trust is so prominent in the beginning of this conversation, because this is essential for not just a good relationship, but to have the potential for healing. Is you need to be in a coherent relationship that's trustworthy. You need to feel like your provider actually cares about you. That's a big part of opening a potential gateway towards healing. One thing I wanted to mention is, because we have these complications right now, is that we're cycling with a lot of confusion amongst that triad that Leslie mentioned, which is the system, the provider, and the patient. And because we all have levels of frustration, at least the human beings that are involved within this system, we get caught in blaming and shaming different aspects of this triad. So you'll see the patients blaming the providers. They don't care about me, or they're not good. You'll see the providers behind closed doors critically judging their patients. And then the last one seems to be where we're at now, is everything's the system's fault. So we need to really get clear as we proceed so we can create that relationship that we all need to promote health and wellness.